All right, looks like we have a participant count that is quickly rising. We'll wait another minute or so before we get started here, but to all of you who are here, welcome. We'll get started soon. Hi again to everyone if you're joining us. We're just going to start in about 1 minute, 4:02. All right, I'm going to jump in. Everyone, welcome and thank you for joining us for the Rockefeller Foundation's Communications Community of Practice and our 23rd webinar since we began last January. We are very excited to hear from this set of panelists hailing from all over the country and so grateful that they're taking their time for us. So just a few housekeeping notes here before we begin. My name is Nina Chung, and I'm joined by my colleague, Tiara Broom, behind the scenes, managing operations, and we and our team at Hadaway Communications serve as the secretariat for this community of practice. Alongside you all who've joined us for this journey, and thanks to our guests along the way, we have learned so much together about what it means to connect not just with abstract mass audiences, but with actual specific communities, to share critical information about testing, vaccines, and health. Today, our panelists are going deep into what this hyperlocal approach to communications has looked like on the ground across 4 different cities since the pandemic began. We'd love to know who you are too, so if you're comfortable, please share your name, where you're coming from, city and organization into the chat box. We also encourage you to feel completely free to share comments, thoughts, responses to what you're hearing over the next hour. And lastly, please drop any and all questions for our panelists in the Q&A box, which we'll be monitoring as we go. And as usual, there will be a Q&A section at the end. So with that, I'm going to pass the mic off to Stephanie Friedhoff, who is professor of the practice and senior director of content and strategy at Brown University School of Public Health, which is one of the foundation's key learning partners in its Equity First vaccine initiative. She'll be leading us forward in this discussion. So Stephanie, take it away.
Thank you so much, Nina, for the fantastic introduction. I am super excited to be here with you all and with our terrific guests who are community leaders and also communications leaders and are really terrific at both. Tara, Ellie, Evan, and Dr. Donna are all also part of the Rockefeller Foundation's Equity First vaccination initiative, as we've just heard. And I wanted to provide just a tiny bit of framing before we dive into the conversation. Last spring, the Rockefeller Foundation made a $20 million investment in supporting community organizations who are working to build vaccine confidence and access, especially in communities of color and low-income communities. And I think everybody on this call already knows that communications has kind of been the ugly stepchild of the national pandemic response, and that building vaccine confidence is hard work that needs to be led locally. And in so many ways as a nation, I've felt, especially in this year as we've been engaging on this work, is we have shouldered community organizations with this hard job to reach out to every American in unique ways. And I'm excited for us to get to talk a bit more about what does that actually mean? And what do we all need to know about it, and how can we use these learnings from this initiative in the work that we all do? I think we are all also on this call keenly aware, since this is a community of practice for communicators, really, right? We know that the needs go far beyond access to engaging information about vaccinations. Every speaker on this call is working to improve health outcomes overall. And that includes addressing food insecurity or access to housing or education and mental health support, and all the other things that we call social determinants of health. These issues, the role of communication, and really the underlying structural barriers for people to access health are at the core of this Equity First vaccination initiative. And our colleagues are going to share how they're squaring away these dual tasks and the bigger efforts within their communities to build health outcomes and vaccine confidence. I've had the privilege to watch you all and your teams. I've been in awe. It's fantastic work, the creativity, the ingenuity, and really the connection and commitment to people and what matters in their lives that you bring. So again, super excited. I'm going to do a very quick introduction to our four speakers today. We have Ali Smither from Houston in Action. She is the member, communications coordinator for the Houston in Action team. She's an experienced grassroots organizer and also, as I hear, a soprano and has many other talents. I love that in the many bios that we read about speakers here and elsewhere, we're now so free in sharing our multiple identities. And that's so important in this work because nobody's just one person, and neither are the people that we speak to and work with, right? So this is awesome. Dr. Donna, same story, right? Is a medical doctor, but also extremely skilled communicator, and has this vision to revolutionize how we view health in the Black community. She is hard at work promoting emotional, mental, spiritual, and physical and environmental health, right? All the things we were just scratching the surface on, and is the host of Talking with Dr. Donna, a health show that's created to really provide people on a consistent basis with important information. So welcome to the two of you, and then also to Evan Serpic from the Open Society Institute in Baltimore. Evan and I share a long background in journalism. He has been the editor of the Weekly City paper, has run award-winning coverage on the Baltimore uprising, local politics, other breaking stories, and has held a number of positions in journalism before moving to this role. And again, Evan has done a fantastic job bringing together so many different organizations. It's really hard, including the Department of Health, right? And breaking down some of those barriers that we've seen in communities for so long. I think this initiative in part has also shown that that's really possible and is important. And I'm sure we're going to hear about Baltimore Vaxxed, right? And some of the amazing work that's come out of that. And then Tara Dowdell, who works with and collaborates with the United Way of Greater Newark team, which is one of the anchor partners on this initiative, is an accomplished entrepreneur and communication strategist. She's founded her own speakers bureau as well as her own communications firm. She's a frequent contributor on television and communicator and commentator on a number of issues, and has really helped communities in Newark professionalize their communications and provided those essential supports. We know everybody's short-staffed. We know there's so many things to do at a time, and to have the luxury of having Tara and her group provide clear guidance, right? Beautiful visuals, clarifying information, I think has been a real strength of all of this. So without further ado, let me turn it over to Ali, who will be our first speaker.
Thank you so much. I am just so excited to be here. I'm going to share my screen. There we go. So hi, everyone. My name is Ali Smither, and my pronouns are she, her, and I'm very, very proud to be the member communications coordinator at Houston in Action. So some goals of what I'm going to talk about today is I hope y'all can leave with an understanding of our hyperlocal relationship-centered communications and how this long-term focus fundamentally challenges the structures of white supremacy, not only in nonprofit world, but also in our communities at large, and how we apply this to our listening sessions and town halls. I'm going to talk about who Houston in Action is, our local grounding, relationships as long-term power, and then our listening sessions and town halls. So what grounds me as a communications worker is campaigns come and go, but our relationships can be forever. And these relationships are key to building long-term power. Who is Houston in Action if you guys don't know us? We say until we all have equal access to participate in civic life, our work will not end. We are a collective impact organization. So we are people and organizations across Houston who have come together to strengthen and grow community-led civic participation and organizing culture in the Houston region. Members, non-member partners are from public, private, and nonprofit sectors. We have several campaigns, the Equity First Vaccination Initiative being one of them, thank you, as well as our census work, electoral work, and our Black, Latinx, and AAPI organizing cohorts. So our hyperlocal grounding. Our member groups are at the center of everything we do. We have over 100 member groups that we work with across all of our campaigns. And with those member groups, we work on coordination between them and also capacity building. Relationships are at the center of the work we do with our member groups, and our relationships are all focused towards building long-term power. We look at success, especially for this campaign, not only as shots in arms, which of course is central to our goals because vaccines save lives, but also long-term community power building. Are our member groups building their capacity beyond this campaign? Are they making connections with related organizations that can benefit them long-term? And are we supporting their long-term growth and paying into their vision? The pandemic was a catastrophic collision of inequity, but that inequity will continue past COVID funding. So we try to tailor our work for COVID funding to also be the groundwork for long-term change. So how does this show up and affect our communications work? I'm going to mostly talk about two ways today. The first one is it challenges and changes in assisting our capacity building for our groups. We assist our groups with many different things, ranging from earned media to resource and material building to digital ads and regularly updated guidelines. And through this capacity building work, we seek to achieve not only the campaign goals, but also skill building, training, and applicable knowledge that will carry beyond the campaign. We also work to create events that cultivate openness with our communities of focus, engage the public with our member groups, and lay the groundwork for the creation of spaces that exist beyond polarization. The first of an example that I'm going to share today is our listening sessions. So over the course of 10 months, Houston in Action held 9 listening sessions with member organizations in our priority zip codes. Listeners were recruited by member organizations, and these were held in a conversational style where we talked about motivations, fears, access, and barriers to vaccinations. We really found in these conversations that it's very rare to find spaces that exist beyond what can sometimes feel like a black and white polarization of either you are good and you get the vaccine or you're bad and you don't get the vaccine. And I think everybody on here knows that it is not that. There is so much space in between, and often people are hesitant to converse about existing in that space. What we found by creating that space and having someone in that space was often enough to move them. It allowed people to be vulnerable about the questions they had and to share that not only with us, but also with other members of their community and groups that they regularly work with. So we applied this knowledge in our COVID-19 messaging that was regularly updated and sent to our groups. We also, by having these relationship-centered conversations, were able to find not only common findings, but findings specific to certain groups of people and personalities. So it wasn't just access, it was creating space. And this process, by doing it alongside our member groups, also allowed us to reflect to them how to build spaces like this for other situations. The second way we did this, and I love this graphic because this was my favorite town hall, was our vaccination town halls that we held on Zoom. In the fall of 2021, Houston in Action held 3 virtual town halls for the public to ask questions directly to doctors. Again, very similarly to the listening sessions for judgment-free conversations, co-sponsored by member organizations who recruited community members with incentives. We found through these people being able to ask questions directly to doctors that trust building could be the antithesis and the solution to misinformation. So some key takeaways: our relationships are long-term power. Building those relationships, although that is a very long-term process and maybe the outcomes are further along, is how we fundamentally change things. And investing in these deep roots creates the trust and grounding that we're looking for in our communications. We're teaching and we're building capacity at every opportunity. So if someone asks me for a material, they ask me for a website to show their vaccination events, I can build that website, but I can also go over to their house, mask up, and show them how to edit themselves, and they can use that for the rest of the longevity of their organization. And of course, messaging is at its best when it's bottom-up planning. Everything is for long-term power building. So if you'd like to stay in touch or ever learn more about what Houston in Action does, my name is Allie, and my email is ally@houstoninaction.org. And thank you for having me here today.
Thank you so much, Ellie. Terrific insights. I think we're going to move through hearing from all of our speakers first before we get to the Q&A. And next up is Dr. Donna.
Hi, good afternoon, everyone. Thank you so much for the opportunity to come and speak to you all. Allie, that was a fantastic presentation. You can come to my house and help me with my website. I'd appreciate that a lot. I'm going to talk to you today about justified distrust. And I believe you have my slides and someone's going to show them for me. So if you can pull them up, I'd appreciate it. So while we're waiting for the slides to come up, Tiara is pulling up the slides. I'm just going to introduce myself a little bit. I'm Dr. Donna White Carey. I am a pediatrician by training. I also have a YouTube channel called Talking with Dr. Donna, and on that YouTube channel, which is weekly, every Thursday at 6:30 p.m. Pacific Standard Time, we talk a lot about my mission, which is to build generational health in the Black community. And my day job, my real job, as I always say, is I am the medical director of case management for Alameda Alliance for Health, which is our local managed Medi-Cal program, insurance program for the county. Next slide, please. So when we talk about the pandemic, one of the things that led me to actually even creating my YouTube channel is that this was such a different experience than we'd ever had before. There were three really new things about COVID that occurred. Number one, it was a virus that most people outside of the medical field had never even really heard of, coronavirus. And then on top of a new virus, we were developing a new vaccine. We hadn't had a new vaccine in several years. So we were developing a new vaccine, and we were developing that vaccine at record-breaking speed. And then finally, in addition to a new virus, development of a new vaccine, we were actually using new technology to even create that vaccine. So a lot of new things were happening with this virus and the pandemic. And I found that early messaging really wasn't helping. The fact that the creation of the vaccine was called Operation Warp Speed didn't really give people a whole lot of confidence that this vaccine was being created in a safe way. There was a feeling that steps were being skipped because we were doing it so quickly. And then in addition to all of these new things, we also were politicizing what really was a public health crisis. There's widespread concern around the vaccine. There was a 2020 survey by the American Nurses Foundation, and only 14% were very confident about vaccine development. And only 15% were very confident about the vaccine safety. And this is from nurses. We know that physicians had a very similar experience. There was a poll from the Kaiser Family Foundation that asked about the vaccine and what were the main reasons for people not wanting to get the vaccine. And about 39% of Blacks who were polled said that it was safety concerns versus about 30% of whites. And about 35% of Blacks stated that they did not trust the vaccine, where in contrast, 23% of whites. So when you looked around, there was a lot of people who were concerned about the safety of the vaccine, about trusting the vaccine. But only this label in what I call a perpetuation of sort of systemic racist ideology was this hesitancy label placed on the Black community. I have never liked the term hesitancy. I never used the term hesitancy because to me, it really wasn't hesitancy. It was actually wisdom. When you know that there is a long history of systemic racism, particularly for Black and brown people, there is absolutely no reason why you should expect those people to be the first in line or to automatically think that a vaccine that's new technology, new warp speed was going to be safe. So this label of hesitancy really, really bothered me. But I kept having to have conversations with people around the Black community and vaccines. And so because I couldn't say hesitancy, I created a new phrase, a new methodology. Next slide. And the phrase that I created was justified distrust. And to me, that really sums up what it was, that there is a history of misuse, abuse in the scientific and medical community for African-American folks and Black and brown people. And so the fact that we had concerns wasn't hesitancy. It wasn't something out of the ordinary, but it was justified distrust. There's a quote from a book by Harriet Washington in her book, Medical Apartheid, that I want to share with you that I think helps to summarize and sum up what I'm saying. The quote is, "The experimental exploitation of African Americans is not an issue of the last decade or even the past few decades. Dangerous, involuntary, and non-therapeutic experimentation upon African Americans has been practiced widely and documented extensively, at least since the 18th century." So when you layer that on top of all of the newness, on top of the messaging, there to me was justified distrust in the vaccine. Next slide, please. And so when you think about, okay, well, why was this hesitancy label set there? And why are we doing all this extra effort in trying to convince Black communities that this vaccine is safe? And so to answer that, I want to do a parallel of what we do in pediatrics. So as a pediatrician, and I don't know if you've ever noticed this if you have kids, that pediatricians, we don't wear white coats. And the reason that we don't wear white coats is because our patients, our kids, as soon as they see the white coat, they connect that with pain or something's going to happen. I'm getting something shoved in my ear, something down my throat, sticking out my tongue. There's something unpleasant getting ready to happen. And because they are not always communicative, depending on the age of the child, they will throw a tantrum. They'll start screaming and crying, which makes the job of the pediatrician impossible. So what we decided as a discipline, so that we could create an environment in which our patients felt safe and felt comfortable, regardless of how wonderful I think I am as a pediatrician, how big I smile, how welcoming I might think that I am. The mere presence of that white coat on me caused anxiety. And so as a discipline, we decided we weren't wearing white coats so that we can create a safe environment for our patients. And to me, this parallels why we're making this extra effort in the Black community to have conversations around the vaccine and its safety. It's because we want to make sure that people recognize this long history of abuse in Black and brown bodies around science and medicine. And that in order to help make our patients feel safe, we have to meet them where they are. And we have to attempt to disarm any anxiety that might be felt simply by me walking into the room. So to me, that justifies our extra effort. Next slide. So what is this extra effort I'm talking about? What is justified distrust? It's the 4 A's, as I call it. First, you want to acknowledge, and then ask, and then address, and then advocate. And then I throw in a 5th A, to do it again. And that is the concentric circles. It's peeling off layers. You may have to have this conversation more than once, but following this pattern can really help you to break through, to talk to people who have concerns about the vaccine and to be able to address those concerns. Next slide. We're going to go A by A. The first A is acknowledge. So again, this is letting your patient know, or the person know that you're talking to, that you are aware, that you understand, and that you empathize with the centuries of medical and scientific abuse in the Black diaspora. So it's not just the Tuskegee syphilis study, which went on for 40 years, 27 years, I believe, after the invention of penicillin, which was the treatment for syphilis. And then we have this, what we acknowledge as the father of modern gynecology, James Sims, who basically created all of the techniques that he's known for by doing experiments on Black slaves without anesthesia, because he felt that slaves just didn't feel any pain. And then we think about scientific theft, which continues to use the HeLa cells from Henrietta Lacks, who was a woman who was being treated for cancer, and her cancer cells were actually used and taken without her consent or knowledge to be to continue to use in scientific experiments, and created actually the first human cell line, which we use still to this day to create scientific advances, and actually had a part in creating our COVID vaccines. So we have to acknowledge that this occurred, the scientific and medical abuse occurs. We also have to acknowledge, as people who might be providing the care, like physicians or other healthcare professionals, that the privilege of automatic trust has been lost. I don't automatically have folks trust because I have MD behind my name or that I wear a white coat. There was another part of the poll from the Kaiser Family Foundation, and it asked, do Blacks think that the healthcare system treats them unfairly based on their race? 70% of Blacks said yes, versus 41% of whites and 42% of Hispanics. We have to acknowledge that first and foremost. And we have to acknowledge that the confusing messages around the virus and the vaccines, recommendations changing every day, we have to acknowledge all of these play a part in people not running out to get the vaccines. Next slide, please. The second A is to ask. And so asking your patients their concerns about the vaccine, not assuming that you know what they're concerned about, and not just immediately talking about the science behind the vaccines, but really opening up your ears to listen. It's why in my YouTube channel, I make it a point to have a live question and answer during every show, because I want people to ask me what they're concerned about so that I can make sure that I understand how to have the conversation with them. Next slide. The third A is to address, and it is to directly address their questions honestly. Now, because of the changing recommendations that occur so quickly, it's easy to not know the latest information. And what I try to encourage people is to say it's okay and admit if you don't know the answer. Go back, research it, and then get back to the person that you're talking to. Making something up is going to really be detrimental to your trust relationship. And then there's just so much erroneous information that people have easy access to, that if you give an answer that's incorrect, they can find someone else who can give them the answer that they might actually be looking for, or provide what seems to be a reasonable conclusion, but might actually be inaccurate. And Georges Benjamin, who's the executive director of the American Public Health Association, says, let's keep it at a kitchen table level. So when you address the answers, that you address people in the way in which they can understand it. Colorful, helpful language. Next slide. And the last A is to advocate. And you want to encourage people to make the best decision for their situation. We have to recognize that the vaccine is not available and recommended for everyone. So you want to make sure that you're considering people's health conditions when you're advocating for the vaccine. And you also want to use family members. We had a vaccination poll site as a part of our church. We partnered with FEMA, we partnered with California Governor's Office of Emergency Services, and one of our local clinics, Lifelong Medical Care. We held vaccine clinics, and we did a survey during those clinics, and we asked people what made them come to get the vaccine. And the majority of the people surveyed said it was to protect a family member. So using that to help advocate for those in their households who might be vulnerable because they can't get the vaccine, like people who have immunocompromised health conditions, or for our younger pediatric populations who are, younger than the age of 4 that cannot get the vaccine. So using the advocacy around family members to help advocate for the vaccine. Next slide. And this is the 5th and final A, which is again, do it all again. Thank you. Next slide. And this is just a quick little slide of my show. Again, talking with Dr. Donna, Thursdays at 6:30 Pacific Standard Time. Thank you so much for the opportunity.
Thank you. Thank you so much, Dr. Donna. Already, right, from the creation of spaces that exist beyond polarization to listening to this great overview of justified distrust. Fantastic presentations. Thank you both. Evan, excited to hear from you next.
Hi, thank you so much. And those are incredible presentations. It's hard to follow. It's a lot of wisdom and a lot of things that resonate in different ways with the work we're doing here. So my name is Evan Serpic. I'm the Director of Strategic Communications for OSI Baltimore. And we've been the anchor partner for the equitable vaccination work happening in Baltimore. And I've been sort of leading the communications effort along with, co-leading the broader work. So it's really interesting to hear the previous speakers because I think a lot of it does go back to the way we thought about this work initially. We really focused our work initially. We're thinking about 4 kinds of work as we anchored the work in Baltimore. Vaccine delivery was one, community outreach was one, the communications work, and then advocacy. And then as we thought through it, really it became clear that the community outreach and the communications work went hand in hand, and really they needed to go hand in hand to be effective, for either to be effective, which really goes back to that phrase hyperlocal, I think, and the way Ali talked about the relationship-based communications, which is really the way we thought about it. So there had already been significant work done in Baltimore, as I'm sure in the other cities, when we started our work with the Equitable Vaccination Initiative. And so we identified some partners and really kind of served as a bridge between the work that had been being done by the city, by the Baltimore City Health Department, which was actually doing some incredible work in communications. I don't know if folks have seen the Baltimore City Health Department Twitter feed, but they've been doing fantastic work. So we really connected them, and then some of our community-based partners, including Baltimore Core and Black Girls Vote, and I think Natasha I saw is here today, which is great, from Black Girls Vote, and tried to leverage the work that was being done and also build a bridge between the information that was being gathered and shared and the communities who might not be accessing it. So we, in talking to all those folks and bringing them together, identified, well, what are the existing needs? And really the health department in their work so far had built a really good foundation in that they had done community town halls, conversations about what were the best ways to share information. And one thing that has really served very well was the identified 9 value communities. And these were folks who were most at risk from COVID and may be more difficult to reach. So this included older people, immigrants, people experiencing homelessness, pregnant and lactating people, people with disabilities, young people. And then once the vaccine was open to 5 to 12-year-olds, they also added a whole core of youth ambassadors, which have been really a fantastic asset and resource. So in talking to the health department and using that those platforms, we identified, or the health department identified with us, a need for a new website, which would really, a website and really a platform, including social media channels on Twitter and Facebook and TikTok and Instagram, that would serve as a bridge to the digital world. And so we created bemorevaxxed.org. And you can take a look at that, but it's been a hub for all kinds of good resources, everything from like really highly technical CDC data to memes and videos and audio, and that we liaise with a group called Voices on Vax, which is really geared to young people, and had sort of a lyrics contest for people to rap about vaccines in the pandemic. So that's been one sort of hub of information. They also really requested more video content, the health department. That was one area where they weren't able to really produce. And so we worked with PGP, Public Good Partners, and came up with this idea for a How I Knew video series, which was basically testimonials from Baltimore City residents talking about how they knew it was right to get vaccinated. And in these conversations, it reminds me so much of Dr. Carey's work about sort of that, blanking on the phrase, but it was such a good phrase, about the wisdom that people have about their, lack of willingness to necessarily get the vaccine, because we had people talking about where that was coming from and what it was for them that made them feel like it was the right thing to do. So we have those series of videos that are also up at the website, and the other, and that we've been pushing out on social media, and those have actually gotten a ton of engagement. It's really clear that the personal connection, that's the way communication works. When you hear a person who lives in your city, and we identified folks by their neighborhood, and it really resonated with people, which was really nice. And the other thing we've done from early on, and this is what I want to share a really quick video from, is we've done these events called Baltimore State of Vaccination events, which were a way to share. It's another way that the community outreach and the communications sort of fed each other. We celebrated and lifted up the folks who were working in communities to do outreach. And that's what I'm going to share a little clip of. And we also had public health messaging from some community-based health workers. We had the next event is actually tonight. And in this one, we have a whole section with a mental health professional talking about personal wellness through all of the hardship that communities have been going through, and we have the testimonial. So it's been a really good way of communities seeing themselves in the communications that we're doing, and then hopefully helping to on a one-to-one level help spread the word. So I'm going to try to share my screen and share like a little 2.5-minute clip of tonight's event, which is going to air on public access TV in Baltimore and then be available for streaming. Let's see if this works. That's the one.
Baltimore Heroes, honoring some of the many grassroots, community-based organizations who faithfully serve the residents of Baltimore City before, during, and after the COVID pandemic.
Hi, my name is Bishop Angel Nunez. I am the senior pastor of the Bilingual Christian Church of Baltimore. We are so excited about what we're doing today, especially the fact that we are able to serve our senior citizens. We are excited. We have our staff here working together, and people are getting vaccinated at this moment, and more are coming in. Please, if you're in the area, this is your opportunity. This is your moment. We are doing it, serving our community with love and respect. The need in the Latino community, in particular, the language barrier, the fear, the misinformation was critical. We could not just sit by and do absolutely nothing. We had to respond to the crisis that we were facing, and so we embark in not only citywide, but really across the entire country, trying to get our communities vaccinated. We've reached over 6,000 Hispanic families, feeding them providing information, education, and walking them through the whole process. Our church is very, very active, also teaching the children about different things that they need to learn to protect themselves. We were the first to do COVID-19 testing, and then we did the vaccine and providing the information. We did a number of recordings with the governor's office. We did one in Spanish, we did one in English. The Spanish one generated about 32,000 views, and the English-speaking one, 36,000 views. And now we just launched another one, and that one has a little over 1,500 views.
Art Squeaky Kirk. I'm founder and CEO of the Weekly Kirk Recreation Learners. It's a community center. It started out as just a recreation center for kids, but it's actually a community center where we have a garden. We're back here with the garden right now. We have at-school program for kids. We do free summer camp. We do food drives. We do coat drives. We do toy drives. And every week we feed 800 families a week, Monday through Friday. We first started getting involved with the vaccination clinic when we realized that there was a need in this community. I had reached out to the governor's administration. I told them that people in my area are not going to go to the stadium. They're not going to make it down to these locations where you have it set up like the convention center. Some people will. So I was saying, like, I got to bring it closer to the communities. A lot of things that we have done here, we try to bring it close to them because I know that they're not going to leave this community to go get it done. So we've been able to make a lot of things happen. Like we have our clinics right there in the basketball court. It's been beneficial. I know my people, and I know that if you say that they got to go to the stadium to get it done, they thinking about how many people there, whatever, and they saying, why you can't bring it here? So I said, all right, I'm going to bring it here to you to give you no excuse. So that's what we did. We try to get it as close as possible. You know, we doing the same thing here at the center that they do down at the stadium. We just trying to make sure we take care of this community and give them no excuse for not having it done.
I'm the executive director.
So there's several more stories, but I'll leave it at that. And just that those are some of the community hubs that we were standing up as part of the community outreach. And I think the key thing there is the way the work in community feeds into the communications and vice versa. So I'll leave it there.
Fantastic insights, Evan. Thank you so much. And I love the phrase of community seeing themselves, which I think is at the core of so much of this. Let me hand it over to Tara Dowdell before we get in. Everybody, please post your questions in the Q&A. After this, we'll get to questions.
Thank you so much, Stephanie. And it was really great hearing from everyone. It's so inspiring to be in a room, or I guess in a Zoom, with so many people doing such great work and such necessary work, and hearing all these positive stories. So we are excited. I want to introduce my colleague, Angela Williams, who's been running the point for us day to day at Tara Dowdell Group on this project, and who will be co-presenting with me today. And Tara Dowdell Group is a social good PR and marketing agency, and we're located in the great city of Jersey City, New Jersey, which is Newark adjacent, so it's okay. All right, let me go ahead and share my screen. All right. So I think it's best to start our presentation today with how we started our campaign and how we approached our campaign in the city of Newark.
Let's get vaccinated.
All right, so that's how we kicked off our campaign. And we thought it was fitting to kick off this presentation today the same way. And in terms of the campaign, what we wanted to cultivate from the very outset was this sense of community. The sense of getting vaccinated was about the community, for the community, by the community. And so we launched the campaign with a pop-up vaccination clinic in the city of Newark, and we did it at IHOP. It's a central gathering place for the community in Newark. It's a high visibility area, and most importantly, it's owned by a trusted member of the community. It's owned by a woman who owns 4 restaurants in the city of Newark, 2 IHOPs. In this particular IHOP, she was kind enough to let us use the space and turn it into really just a festive community gathering focused on building trust. And so that's how we started off the campaign. The other side, while we were doing the pop-up vaccination clinic, which we're very proud of, we were able to facilitate 250 vaccinations from the start. And we had lines of people lined up to get vaccinations there. We actually ran out of supply. But what we did on the other side was we held a press conference to amplify what we were doing. And that's what you saw in the video as well. And we had leadership, community leaders, elected leaders, organizational leaders all over the city participate to further amplify what we were doing so that we can create excitement around what we were doing. Oops, sorry. So in terms of that theme, so we work to have a inclusive, unifying theme. Language. Newark is very diverse. The Black community in Newark is very diverse. The Latinx community in Newark is very diverse. There's a large Portuguese population in Newark. And so we wanted to identify a theme, again, that connected all of these communities. And so we came up with the campaign theme of do it for her, do it for him, do it for them. We thought that was inclusive also for the LGBTQ community as well, particularly those folks who are non-binary. So this was the theme that grounded our campaign, and we felt that it cut across all of the different diverse members of the diaspora, whether it be the Black diaspora, the Latinx diaspora in the city of Newark. And so this is how we approached the start and carried through the entire campaign. And as I spoke of, this is Adena Bio. So what you're seeing here is an ad that we were running in Penn Station in Newark, which is the largest train station in the state of New Jersey, and certainly the largest in the city of Newark. And again, going back to that Our Community, Our Fight, we enlisted trusted community leaders to help spread our message. So it wasn't just about having the event at Adena's IHOP, but also enlisting her because people admire and respect her. She grew up in public housing in the city of Newark. Everyone knows her. She's a large employer, but she's an employer, a social good employer, and a responsible employer that people like and trust. So we enlisted her help also to help us spread the word. We ran a 5-month transit campaign in the train stations as well as on buses. And so here are some of the ads that ran on the bus wraps that ran throughout the city. What we did was we hyper-targeted the bus routes to the areas where the vaccination rates were lower. So we definitely tried to marry our communications with tactical approaches, with outreach, and really amplify the work that the sub-grantees were doing in the city of Newark so that we could support and make sure that all of our materials and our visibility and our communications were supporting, advancing, and amplifying what they were doing. So in those areas where the rates were lower, that's where we concentrated a lot of this effort. And as you can see, Portuguese, we even had, working with the other marketing firm on this, they translated the materials to Portuguese. And then in terms of how we approach messaging, which we, again, feel is foundational to our work, our community, our fight, all of that again, carrying that theme through. So we started to, when we didn't call out misinformation as much as we should have in the beginning because we had such great response in the beginning. But when we got to the point where we saw that the misinformation had become so prevalent, we then adjusted our strategy and we explicitly and aggressively called out misinformation, whether in every quote we wrote for a press release, every touch point, we addressed misinformation. And not only did we address misinformation from the standpoint of having and asking the grantees and explicitly saying ourselves that there's a lot of misinformation out there. We did that, but we also asked them to explicitly state that this misinformation is being targeted at our community, that is being targeted directly at Black and brown communities, trying to stop us from accessing vaccines that can, life-saving vaccines. So we asked people to do that. We found the data, and Stephanie, thank you for apprising us of this data point, that it was something that we thought was the case, and Stephanie verified for us that just the very act of telling people about misinformation changes the way they filter information that they receive, which is what we were aiming towards. I'm going to turn it over to Angela now to talk about emotional intelligence and trauma-informed communications.
Hi, everybody. My name is Angela Williams. I'm so happy to be here with all of you. And I do want to take a little bit of time to touch on emotional intelligence and how we were able to infuse that with all of our communications. It was extremely important for us to understand and acknowledge the trauma that Black people endured within the medical industry. We knew that this would be a challenge approaching this work. So many of these valid and justified concerns, we knew we'd have to address them. So within those communications and that guidance, we wanted to emphasize the importance of kindness and being gentle and being patient when having these conversations. We wanted to emphasize the importance of listening to understand and not listening to respond. We all know that a lot of these conversations can get very uncomfortable and are a little frustrating sometimes, but it was really important for us to just explain that it is okay to be patient, and you should be patient, because not only does the community deserve patience, we all deserve that as well. So with that being said, to go a little bit deeper in how we operationalize that, we also fuse trauma-informed communications in a lot of our materials. So we all know that adverse effects are extremely rare as a result from getting vaccinated. However, if you are someone that fell into that percentage, you aren't too concerned of it being extremely rare at that point, because it hits very, very close to home. So it wasn't enough for us to say, hey, only a certain amount of people are experiencing this. We wanted to just make sure that people feel seen and that folks' feelings are actually being validated. So some of that messaging looked like just emphasizing that no medication is perfect, amongst other different analogies that we use to really just try to break down the importance of getting vaccinated against this deadly virus.
And in terms of other adjustments that we made as throughout the campaign, we felt it was important to be very agile, because the situation was fluid and remains fluid. There was no Omicron variant just a few months ago. So we wanted to remain agile and make adjustments when we felt they were needed. So that was something that we prioritized. And so we started to highlight overall wellness, because we started to hear feedback that why is there so much emphasis on the vaccine when they're all at the sort of, people felt like we were doing it at the expense of these other illnesses that were also deadly in our community, given the health disparities that exist in Black and brown communities. So we started to highlight overall wellness and tie this into overall wellness and expand and broaden our messaging in that way. We also, throughout the campaign from the very beginning, we reinforced the importance of family and friends. And so not only did we speak to the unvaccinated, but we spent a lot of time speaking to the vaccinated and reminding them how important it is to speak to the unvaccinated. Because we know from the data that the most effective way to get people vaccinated is when their family and friends continue to push them to do so. So we wanted to make sure that those folks who were in a position to do that were aware of this data point, were aware of the fact that they were the major influences in the lives of some of the people who had very legitimate or justified distrust, to quote Dr. Donna. So we wanted to emphasize that.
Yeah, Tara, I'm going to jump in here with apologies. Given the time, I would love to get at least these two great questions in that we have. If you want to close out.
Okay, I'll close out. So then so I'll just skip this. We supported the sub-grantees. We created a pop-up clinic planning and outreach toolkit deck for them. So we took the lessons learned and the best practices from our pop-up event so that they could just hit the ground running. So we felt that was really important to give them that so they could build on the momentum that had been created. Thank you.
Fantastic. Thank you both so much. And thank you all for these great presentations, such diversity already in approaches. And that's really great to see. I wanted to quickly highlight two questions that we've seen. And I'm just going to ask you to each give a quick response since we're running short on time here. One is, how really have you dealt with and addressed hard to reach populations, both the unhoused and those that don't have, like at some point in this project, I learned that about 50% of the households in Newark don't have access to broadband, right? So we often forget about populations that are really not even reached by some of these amazing efforts. So how have you tried to address those? And then there's also a question about, what are you seeing now post Omicron? Are people just done with this, and done with the whole vaccination? And you can pick one of these two questions that you'd like to answer. And I'm going to start with Evan.
Sure. I mentioned briefly in the Q&A box that really that was partially the health department identified communities that would likely be hard to reach. I mentioned that. And so then really just identified folks who were already working with those populations. So they mentioned the unhoused population. We gave grants to the Franciscan Center, which does twice a week pop-up food events and distribution clothing events. So we provided support for them to also do vaccine information distribution. They are very much trusted by that population. And so they actually had a fairly good uptake. They actually provided vaccines too. And that's similar, working with, we have a grantee working with doing outreach to sex workers, the Sex Workers Outreach Project. We had, disabled or, Disability Rights Maryland doing work with that community. So in general, that's been our strategy.
Allie, you're next.
Yeah, similarly to what Evan just said, a lot of the groups we work with do extensive in-person work and they invest in their community relationships. So we help to provide them with print materials they might need in person and support for hosting vaccine events at their other events, whether that's their farmers market. I went to one at a community center the other week, just embedding that vaccine work and reaching those targeted populations who may not be online.
And Tara?
So what we did was we worked with, one dynamic that we found in the very beginning that was really troubling was that a lot of people were trying to get vaccinated in the city of Newark and could not. And people were coming from the suburbs and wealthier areas and coming in and getting vaccinated and taking those spots. And it was because of the technology barriers. And so what we did was we worked with one of a few of community-based health organizations to establish dedicated phone numbers that only we would do outreach and share those numbers. So those numbers did not get shared broadly. We just shared them through a network of community-based organizations that service populations, particularly more vulnerable populations in the city of Newark. And so that was, I think, one of the most effective things we did. And that's how we ended up getting so many people vaccinated at our first event. And then we just got them to keep the number.
Dr. Donna, can I ask you to quickly, we're going to do this radio style now. We have, 30 seconds to a minute for the question of, are people done with this?
No, people are not done with this. We're not done with this. Coronavirus is not fatigued, so we cannot get fatigued because we still have a lot of work to do. So we will continue as long as we need to.
Thank you so much to all of you for these amazing insights. Thank you, everybody who stayed on for the hour and a little bit of overtime. I'm going to hand it over now to Nina to close us out. Come visit us for one of the future sessions. And thanks again to everyone.
Yeah, just echoing Stephanie, thank you all so much for joining us, to all of our guests for Rockefeller Foundation for supporting these webinars, and to our panelists, thank you. This was an incredible amount of information in the span of an hour, and we know that it's just the tip of the iceberg. So we appreciated all the work that you're doing for our country. So to everyone else, we'll be sending a recap email with resources and a recording soon. So keep an eye out for that. And our next webinar is same time, same place, different date, February 9th on Wednesday in 2 weeks. So hope to see you there. Thank you so much.
Thank you.